Hello, everyone. Today's session is about types and classification of medicines. This session for HND students in Health and Social Care course. My name is Riham Ahmed. You can see my email riham@scholarsschool.ac.uk. So if you have any question about this session, please email me. In today's session, we will discuss the classifications of drugs, the main types and forms of medicines, the routes of administration of medicines, the 5 rights of administration and medication administration, and using the MAR chart. In general, medicines are taken for many different reasons. For example, medicines to treat a condition, like antibiotics to treat an infection. Also, medicine to control a condition, for example, a medicine to lower blood pressure or high blood pressure. Also, medicines to treat the symptoms of a condition, for example, painkiller. Also, medicines to prevent illness that may happen. For example, vaccination against disease, like COVID-19 vaccine. As a healthcare worker or carer, so remember, when it comes to administrating medicine, the more knowledgeable the practitioner, the safer he or she will be. That's why in the UK, there's a classification system, clear classification system for medicines. And there are various legal controls on the retail sale and supply of medicines in the UK. And all these classification systems and system and legal controls set out in the Medicines Act 1968. In general, there are 3 categories of medicines. First one, prescription only medicine, POM. Second one, pharmacy. Third one, general sale list. First one, prescription only medicines. These medicines may be sold or supplied only from a registered pharmacy and in accordance with a prescription issued by an appropriate practitioner, for example, doctor, dentist, or nurse. In general, the prescription-only medicines, these medicines for serious health condition or serious health problems, for example, kidney disease, heart disease. So it needs a prescription from practitioner and also the pharmacist to supervise this medicine as well. Pharmacy, second category is pharmacy. These medicines don't require a prescription and may be sold or supplied only in a registered pharmacy and under the supervision of a pharmacist. For example, anti-acid tablets. Third one, general sale list. These medicines don't need a prescription from practitioner or supervision from the pharmacist, and the patients can find it in the supermarket. It's like Panadol, Cetamol, or vitamin C. Also, there are many forms of medicines, and as a person who will be trained to administer medications or medicines, so you should be familiar with all forms of medicines. And the forms of medicines are liquid, lotion, spray, ointment, drops, tablet, capsules, powder. Also, there are different routes of administration. In general, there are three main routes, like IV, intravenous, IM, intramuscle, SC, subcutaneous. Also, there's specific role like inhalation, oral, topical, or rectal. The routes of administrations, in general, they are different according to the medicines actually. So some medicines are administered in a simple way, such as by applying a cream or tablet, liquid. However, other medicines are administered by specific techniques, by using specific techniques. For example, insulin by injection and giving oxygen. There's 2 types of administration of medicines. First one, self-administration of medicine. Second one, secondary administration. So In general, self-administration of medicines, it means the patient takes his or her own medications independently. The patient should ensure that records are maintained. So also in self-administration, the patient should be safe clear records about medicines, and in terms of storage, a lockable space should be allocated for the safe storage of medicines. However, in the second types of administration of medicines, secondary administration, it's made up by the healthcare provider, and according to the Medicines Act 1968, so medicines should be administered strictly in accordance with the prescription instruction. So the medicines shouldn't be given for any reason or under any circumstances to other service user. Also, care establishment must have a clear procedures for safe administration of medicines. There's 5 rights of medication administration. These 5 rights can help the healthcare provider to administrate the medicines safely. First right patients. So the healthcare providers should check the name on the order and the name of the patient. Right drug by checking the medication label and also the order. Third one, right dose. The healthcare providers should calculate the right dose for the patients, and right route. Again, the healthcare provider should check the order and also the route ordered, and also confirm that the patient can take or receive the medicines by the ordered route. Right time. Check the frequency of the ordered medication. Also double check that you are giving the ordered dose at the correct time. Confirm that the last dose was given, and the last step to document administration after giving the ordered medication on the medicine administration record or MAR chart. All these rights or 5 rights can help the healthcare provider to administrate the medicine safely. Use of the MAR chart. In general, all records relating to medication and its administration should be clear. Black ink, it's the best way to record information on the MAR chart. Also, when signing for administration of a medicine, you are, as a healthcare worker, legally accepting the full responsibility for its safe administration. The MAR chart must be kept and up to date all times, and also complete with utmost clear and accuracy informations. So the information that's recorded on the MAR chart should include name, age, and sex of service user, a list of drugs allergies, name and the signature, name and strengths of all medicines, prescribed dosage, route of administration, frequency and time of administration, prescription start date, any specific instructions, and the signature of the healthcare provider. As a summary of this session, so we can say follow the instructions to administrate the medicine safely. Check the 5 rights regularly before administrating the medicine. Use the MAR chart to document the procedures of medicines administration. If you have any question about this session, so please email me. My email riham@scholarsschool.ac.uk. Thank you for your listening.